This idea of self-control and willpower is getting so much more attention in the media, and so we wanted to first just kind of take a first pass and see whether or not weight loss was associated with self-control or willpower at all. So we conducted a quick preliminary study in which we examined whether self-control assessed towards the end of a weight loss program was associated with any of our outcomes, just to see if we were getting any sort of a signal. And we did. We found that self-control was actually substantially associated with better weight loss outcomes, adherence to a low-fat diet, physical activity, and attendance at treatment sessions. So then we conducted a second study, and it was the same thing within a weight loss program, and we found that changes in self-control during the weight loss program, so those participants who had an increase in self-control during the weight loss program from pre to post actually experienced the best outcomes. So again, they lost the most weight, they tended to eat a healthier diet, they also increased their physical activity more, and so one thing that was relatively interesting about this study is that in that second one, where we assessed it at both pre and post treatment, the level of self-control that participants had when they entered the program wasn't important in terms of predicting how they would do. Instead, what was important is whether or not their self-control increased during the intervention. These results suggest that if you are to practice self-control during a weight loss program, that by eating a low-fat diet, by making yourself engage in physical activity when really you don't want to, on those nights when you're tired and you come home from work, by going to a group meeting on those nights when you'd rather stay home and hang out and veg out, but instead you go to your weight loss meeting. So those things could quite possibly help people improve their self-control. So the idea is that self-control might be like building a muscle. So the more you practice self-control or exercise self-control, so to speak, the more your self-control will increase, which will then improve your longer-term health outcomes. So if you can just kind of get past that initial point where, gosh, I really want to give up, or, oh, I don't feel like dealing with my diet, my physical activity, or attending that group meeting for weight loss. If you can get past that initial point and kind of make yourself do it, you might actually experience an increase in self-control, which will then help you longer term and help you achieve a greater weight loss, which I think is kind of an interesting thing and has treatment implications.